My name is Vadim Koshkin. I'm a recently graduated Pritzker medical student. So when I went on this trip, I was a fourth year, and this is actually the last thing that I did in medical school. I'm going into internal medicine at the University of Michigan. I'm starting that in a couple of weeks. The trip I went on was to sub-Saharan Africa, or West Africa to be more specific. I went to Ghana, Korle-Bu Teaching Hospital in Accra for about 10 days. And then Ibadan, University College Hospital in Nigeria for another 2.5 weeks or so. So I've always been fascinated in this by this region specifically, like sub-Saharan Africa, without really any good reason that I can point to. But I was just that's always where I wanted to go, and so I went for the first time in like the summer after my first year, so right before my second year, with a different program. And that was, I mean, I was already in medical school. That was really before I had any sort of exposure or much of an exposure to clinical medicine. So I spent a month in Ghana, and I mean, it was wonderful. I enjoyed kind of like the region, the culture, the people. Everyone was really welcoming and friendly. And so I knew that I would want to go back once I had a little more of a clinical background. I approached the Global Health Initiative, specifically Dr. Olapade, about this. And by then I'd also developed kind of like my interest of what I want to do for a career. I specifically wanted to see if I can combine my two interests in global health on the one hand and oncology on the other. And that's why I specifically chose to do this rotation. So in Ghana, the rotation was basically a clinic. They would see patients all day, and basically then go for their chart and then administer the medications and decide kind of like the next plan of treatment, and also schedule them for their radiotherapy sessions. In Nigeria, as I said, there weren't really typical days. They would operate, I think, 2 days a week, like Tuesdays and Thursdays. And then a couple of the days were also clinic days, and Friday was a chemotherapy clinic day, which we would just, other days we would round every day starting at about 7, 8 a.m. and then just kind of like take care of patients throughout the day and get admissions. So I mostly interacted with the two interns, or well, they just call them house officers, basically. I became pretty good friends with them, Dr. Ilabachi and Dr. Iwale. And yeah, and we even, well, I mean, they don't really have any time outside the hospital, but the limited time that they did, we did hang out. And then there were more senior residents as well, the registrars, who were also very good and into teaching, and I enjoyed the interaction with them. In terms of language barriers, with the people who are, I would say, well, certainly with the people who have gone through medical school, so have a significant level of education, there were none. I mean, they speak English that I understand, and vice versa. So for the most part, and both of these being English-speaking countries, it was completely fine, no barriers. I mean, first of all, I would say that I can't recommend this region enough. I think I've really enjoyed both experiences I had there, and particularly this one, because, well, in my experience at least, everyone was really open, really friendly, and always willing to help. And what I especially appreciate is that this, having traveled to kind of other places like Europe, even Eastern Europe, Middle East. Sub-Saharan Africa, I mean, as I guess most people would expect, is very, very different from what we expect in most ways that I can think of. And in that sense, it was a very unique experience, just kind of like seeing how, even though, I don't know, a lot of the behavioral norms, a lot of, the ways in which people interact are very different there. I would say still the similarities just between people there and people here, people everywhere basically, are sort of rise above all that. And that was, for me, that was kind of the most eye-opening, how despite the big differences, we're very, very similar. I appreciated the educational aspect kind of what I gained from this. Because, well, as I mentioned, I'm interested in oncology. Oncology is practiced quite differently there. And it was really worthwhile for me to see that and to see what their specific challenges are. I had first gone when I had no clinical experience, just kind of get a sense of the place. And then I came back as kind of like a more advanced, a more senior medical student when I've had some experience. And the idea was always to then come back as a resident when I can actually contribute to clinical care more as an MD. And eventually to also incorporate this as part of my career. I see, well, at this point, I see kind of my career going in more of an academic direction, and I definitely want to keep the involvement with West Africa and with the region. And so for me, also part of going there was to kind of establish a relationship with people and see if I can actually kind of work fruitfully there in my future career. And I think I accomplished those goals. So to sum up, I would say I'm really glad that this opportunity was available for me. It, as I said, it was the last thing I did in medical school, and it really kind of I think put the finishing touch on my medical education, having kind of completed all my clerkships, rotations, etc. in the United States, and then also seeing part of the world that's as different from here, I would say, is probably any other place in the world. I want to thank Pritzker and the Global Health Initiative for even having this opportunity, and specifically Dr. Olapade, Dr. Shola Olapade, and Dr. Fumi Olapade, who also I met in Ghana when I was there. I want to thank in Ghana, Dr. Vanderpoy, who is the one that welcomed me there, and that's the new kind of partnership that Pritzker has just established, or the University of Chicago Medical Center. Also Dr. Edusa, who is primarily who I worked with, the radiation oncologist over there. In Nigeria, it was Dr. Ademola, who's a great clinician and a very patient teacher who took the time to explain everything that I really appreciated. And of course the people I worked with most closely there, who were just the interns there, Dr. Labache and Dr. Arnamale. And lastly, I can't highlight enough how much support I've gotten from GHI. The help I got with funding from Keith Edson, that was also huge. And again, I think we're lucky to be in an institution where A, you get the opportunity to set up this rotation, and B, even get some funds for it. And so, for all those reasons, I'm really thankful to the University of Chicago and GHI.